So get ready for the show. I've sent you the materials. Question paper is in the Telegram and also in the WhatsApp groups. Write down your problems regarding writing tasks. Write down your problems regarding writing tasks. So write down your problems regarding the letter. Yes, write down more problems, more problems. What all problems you have, you can write down. Yes, yes, good, good points you are bringing out. Bring more points. Brainstorm. Bring out more points because I am going to take daily classes. Last time I told, I gave Gail letter. Very good ideas. Come on. Yes, all these points will be discussed now. Yes, last 3 minutes. Write down more points, last 3 minutes. Yes. Yes. Okay. Fine. Now we are going to learn number of these things which are pointed out. Yes. Okay. Yes. Hello and welcome to Seven Sentinels. This is Grandmaster class, a part of classical corrections group. Today we are going to do the writing task. Peter Dunbar, nursing specific writing task. The case is regarding type 2 diabetes mellitus. And I am Peter Simon with you. And I'm an English trainer, professional English trainer. Yes, what all I'm going to teach you today, you will see the difference because, always get to train from a professional trainer. That is what is important because they will help you in a proper way. Don't join somebody because they are just teaching you in translation method. Of course, it is one method. It is a good method for you to understand when you cannot understand on your own. So when children or young, they're tender, they cannot eat on their own, mother will grind food and give them. Yeah, that is fine. But the thing is, they are children and we are matured people. When you cannot do that, but when you can do that, why? Now, you are not small children, you are mature individuals, you are graduates, you are postgraduates, you are doctors, nurses, physiotherapists, and what all professions you belong to. When you can manage, why do you want to translation method? because you're not going to write the exam in some other language. Simplification is okay, but better learn and master. That's important. Learn and master. That's it. If you want to drive a car, don't sit on the motorbike and ride, because you will only ride, you will not drive a car. So remember that. There's a lot difference. There is a lot difference. So here, some people I saw, they were running with the kites in hand. So they're just running because the kite is not flying, they are running. And the kite goes up, and when they stop running, it falls down. That is the case. That is the case. Translation is one method, just to make someone understand, but not to master. Translation method will never help you to master the language. It will only help you to understand the language. That means one-way process, internal. You will get some idea. So they are just translating and making simple for you to understand, but you are not going to learn the vocabulary, you are not going to learn the sentences, you are not going to learn the grammar, you are not going to learn the pronunciation. Just you are made easy. The things are made easy for you to understand. That's all. But when you go onto the platform and try to apply those things, it's just black sheep. You'll be lost forever. You cannot do it on your own, because you practiced in some other language, not in the original English language. Now what happens? The second problem is, when somebody teaches you something and you learn through translation method, two things are happening. There is reducing the pace of learning. That means the rate at which you are learning will become minimized. For example, if you learn through English, you learn in maybe 1 month. What you learn in 1 month, if you learn through mother tongue, you learn in 3 months. And the perfection is extraordinary in 1 month, because you are learning through English. But when you are learning through your mother tongue or some other tongue or language, what happens? The perfection is missing. Then again and again you want somebody to translate. It's very difficult for you. So, if you want to swim, don't swim in shallow waters. While learning, okay, that's okay. But when you're mastering it, learning swimming is done by many people. Swimming, yes, of course. But if you want to master it, if you want to dive, then you have to go to the deeper areas, not in the shallow areas. You will break your bones. If you jump from a vantage point, a higher point, into the shallow waters, you will break your bones. Because the water is shallow and you will hit the ground, and it will be tough time for you. So what if you want, you have to go into deeper area and then you have to jump. That's it. Then only you can be called as a diver or a perfect swimmer. So that's it. Learn English in English. Learn English in English, because you are strong enough. Somebody is not strong enough to explain you in English and make you understand. To overcome their weak areas, their helplessness, they'll translate into some other language. I'm not against translators. Okay? They're actually making you weaker and weaker and weaker. And now, always you'll be depending on some translation. So don't do that. Better learn and master rather than being dependent. Try to be independent. That is what I'm telling you. Okay, fine. Right. Next. There is no difference between was and were. Was is past tense, were is past tense, be form. It's one and the same. It's a form. Be has different forms. We call them be forms. Be is the original verb, helping verb. Be is the original helping verb. It is be, was, been, being, are, were, been, being, is, was, been, being. Yes. Am, was, been, being. There is no difference. All are one and the same. They change their form when it goes to different person. I am. Be changes into am with I. Be changes into is with he, she, and it. It's only a form change, changes its shape. For example, you go to your father, you become a son. You go to your son, you become a father. You go to your husband, you become a wife. Or if you go to your wife, you become a husband. So that is what it is. Form is changed. The label is changed. Otherwise, everything is one and the same. Mr. Simon is a father when he goes to his son. Mr. Simon is a son when he goes to his father. Mr. Simon is a brother when he goes to his sister. So I hope you understand, it's the same person in a different form, different labels. It depends on person, place, time, and situation. There is no difference between was and were. Have and has and had. All are one and the same. Only the form change. For example, you, then it becomes are. So be, was, been, being. Yes, somebody asked. 10 people were there and 3 went off. No problem. Don't mind of anybody. Okay, I'm going to show you the be forms now. Yes, that is what we are learning. Grammar. Grammar is the glamour of language. Grammar is the glamour of language. Yes. Be forms. Yes. Be forms. Be forms. Be forms. Okay, be forms. Actually, be forms. Be forms. Okay. Now, what are these be forms? What are these be forms? Be forms means, okay, state, verbs of state, verbs of state. What is this, sir? You are teaching something new now? Yes. Be forms or verbs, forms of state. Verbs are of different types. Okay. Verb forms. First, you have to know. Yes, you have asked. Very nice. Thank you very much. Verbs. Verbs. Types. Types of verbs. Okay. Different types. Different types. Different types. Now, there are verbs are of 3 categories. Number 1, verbs that tell you about the state. Verbs that tell you about the state. These are called as be forms. Then next one, verbs that tell you about possession. That tell you about possession. They are have forms. If you did not learn early, that is no problem. You did not have an opportunity to learn. Yes. And third one is, okay, action, state, possession, and action. These are the main verbs, and these are the helping verbs. Helping verbs. These are called helping verbs. Have forms and be forms are helping verbs, and action forms are called the main verbs. Okay, right. Fine. That's it. Yeah, that's fine. Yes, absolutely fine. Right. So verbs are three different types. Okay. Verbs are three different types. Three different types. Yes. Okay. Now, if you consider these verb forms, okay, you have to study this very carefully. You have to analyze these. So where they go and how they go. Now, this is the B forms. Right. Next. So now we are going to see the B forms. Right. Okay, I want to ask you because somebody asked me, so I am trying to solve the answer. But these are very essential because many people don't know. Okay. Are you comfortable? Because I started the first question, Divya D'Souza. What is the difference between was and were? That was the question. I got it here on the screen. For when to use has and has had. Okay, right. So these are the questions. So if you are comfortable, okay. Okay. Do you all want me to a special take special grammar sessions? That is better because if we go into grammar, there are many other things. What do you suggest? Do you want me to take special grammar sessions separately and okay, some other time, or do you want me to continue now itself? Now or later? Now or later, because if we continue with this, we'll take an extension. Okay, we'll take a little more time. So what do you say? Now or later? Any one option? Type your answer there. Majority vote, 9 students are there. If majority write now, then we'll take now. Majority says later, we'll take later. That's all. Vote. Your vote counts now. Oh my God. Many people are saying now. Huh? Okay, come on. Now or later, both are okay. Both are okay for me. Because if I take now, I will have to take a longer session. Yes. So majority of telling now. Okay. Rajeshwari, count how many nows and how many letters? Okay, 6 now. And what about later? What about later? Right. Okay. Fine. We are going ahead. So this has been converted into vocabulary and grammar session. Fine. B forms. Number 1 is B forms. Number 1 is B forms. That's fine. No worries. So this is actually, okay, B is the original word is B. You cannot write capital letters when they are just words. B. Fine. Was, been, being, am, was, been, being, okay, are, were, been, being. Nobody will teach you all these things. So when chances there, learn. Am, was, been, being, are, one, being, being, is, was, been, being. Okay. So that is it. Now this depends on the persons here. Persons. First, sorry, this is 0. This is 0. Okay. Right. 0 means normal. B is related to future. B form. Right. Yes. That's it. So, now, so why I am showing you these things are, these are called personal forms. You should know that these are personal forms. So first person, I, takes am. Second person, are, you, takes are, you are. Okay. And third person, he, she, it. Write down. Person, I'll give you detailed explanation. Don't worry. So next time, never in your life you'll make a mistake regarding these things. They're all same. All these are same. No difference at all. So this is it. B. Okay. Right. These are B forms. B was, been, being. This is not a person at all, because be is used in the future. I shall be in Mumbai tomorrow. Okay. So be, was, been, being. Past tense is was. Am. Am is, first one is present tense, second one is past tense, third one is perfect tense, fourth one is perfect continuous tense. Write down. Present tense, past tense, perfect tense, continuous tense. Am, are, is are used in present tense. Was, were, was is used are used in past tense. Been used in perfect tenses. Being used in perfect continuous tenses. That's all. He is being helped. Passive also used. Okay. Passive, present perfect, passive. Present continuous, passive. I am helping. I am being helped. Okay. So like that. So in continuous tense, you use this being. Perfect tenses, you use being. Past tenses, you use was, were, and was. Okay. Now let us see. I'm going to give you the sentences. Writing, read. Okay, Microsoft. Yes. Okay. Tense. Grammar. Grammar. Tense. Okay, fine. Today's date. Okay. Because I cannot do many things, so I'm taking the artificial intelligence and it will be my assistant now. Microsoft official artificial intelligence. Yes. I am a boy. We are boys. You are a boy. You all are boys. He is a boy. She is a boy. She is a girl. It is an animal. They are boys. So, now here you can see very clearly with I, you are using am. With I, you are using am. With we, you are using are. We are, plural. You are. They are. So now plural, whenever you are using plural form, you are using are. Plural. We are more than one. More than one person. More than one person, we use are. We are, you all are, they are. Then what about singular, sir? Singular, you're using are again. Yeah, this is a special because when you see somebody else, it is a mark of respect. Though it is a singular one, it is a mark of respect. It is equal to plural. Respect, that is nothing else. Respect. Next one. He is. This is the danger zone. I'm giving you red. Because many people don't know all these things. She is. It is. Now, why like this? I is first person. First person. What do you mean by first person? First person means, for example, if you have a chocolate, you keep it for yourself. You will not give anybody. That is called first person. Means I am important. I am important. First chocolate only for me. First house only for me. First book only for me. First dress only for me. So first thing only for yourself. The person himself or herself. First person. Okay, personal pronouns are of 3 different groups. So this is called first person. First person. And we, if we have one house, only we will live. We will not give you, will not give them. This is called first person. First person. You. Okay, I am not you and you are not I. So I am first person and you are second person. The person who is in front of you is the second person. The person who is in front of you is the second person. If you attend this session, never you will make a mistake again in your life. You all, we are one group, you all are one group. We are teachers, you are students. So in front, you are in front of us. So second person. The speaker is the first person, the listener is the second person. The speaker is the first person, the listener is the second person. Okay? Right. Are you all okay? I am going deep into the subject. Because I liked your points, so I'm going deep into the subject. Are you all okay? Are you all with me? Say yes or no. If you say yes, that means I am able to understand that you are able to point out what I am teaching you, because these are very important. Many people, nobody will teach you these things, first of all. Nobody will teach you these things. They're least bothered about you. Okay. Then third person. Now, what is this third person? I am the speaker, you are the listener, and we are talking about some other person who is not in our presence, the absent person. The person who is not in our presence, the absent person. The person who is away from us. That is the third person. So, now let us see here. Very good. I want 2 more yeses, at least half. 10 more are there, so only 3 are here. What about the rest? Okay. So 3 means only 3 are interested. What about the others? They are not interested. That is what the feeling here. So very good. 5, at least 50%. That's enough for me. Okay. Right. Now, first person. So the speaker. I am the speaker. So I. Okay. So the listener. You are the listener, the student. So you. Second person. The speaker will always be the first person. The listener will be always the second person. Whoever speaks says I. So he is always first person to himself. The listener will always be the second person to the speaker. It is according to the speaker. First person or second person or third person is according to the speaker. So the person who is speaking, he himself will be the first person. The person who is listening, who is in front of you, is the second person, the listener or the audience. And third person is the person who is not in front of you. The third person is the person who is talked about. My mother was a teacher. Yes, that's it. So I'm talking about my mother. My mother is not in front of me, and you are in front of me. So you are the second person. I am telling you about her, who is not before us. Okay. There is a curtain, there is a screen. Presence and absence. Now you are in front of me. I'm teaching you because you are listening to me. One way or the other way, directly you are related to me because you are in front of me listening to my voice. You are the receiving person. You are the listener. So I am the teacher. We are teaching. I and my other colleagues are teaching you. So then it will be we and you all. That is the plural. More than one. And he, she, and it. So this is it. So these are called personal pronouns. Don't use them in the writing. Don't use them in the speaking. Personal pronouns. Avoid them as much as possible. Avoid them as much as possible. If you cannot avoid them, it's okay. The danger signals. So that's it. These are called personal pronouns. Okay. The danger zone. Avoid them as it shows that these show that you are a weaker person. Now see how I am telling you that the usage of these personal pronouns, them, makes you and you all, her and him and them, weaker persons. So how many personal pronouns I used? Now I am not going to. That means you are a weaker person. You don't know quality English. Using personal pronouns weaken the quality of English language. Where is I? Where is you? Where is he? Where is it? Where is they? Where is them? Where is they? What are these? Nothing, nowhere. So this is called quality. Personal pronouns deteriorate language quality. Finished. The essence is understood. The doctor, okay, he has prescribed him, the patient, it, the medication. Okay. Now, the doctor prescribed Gerald Baker the medication. Why the doctor? Why Gerald Baker? Insulin injections were commenced. Finished. He prescribed him insulin injections. What is this nonsense? Why should we tell all these things? Okay. So, understood how personal pronouns break the quality, deteriorate quality. Quality deterioration is perfectly performed by personal pronouns. Quality deterioration is perfectly performed by personal pronouns. Understood? If you recognize the importance of what I'm telling, you will not use personal pronouns as far as possible. Yes, that is important. Thank you, Greta, for your yes. Because if you say yes, then I can move forward. That's the point. That's the point. You know, even a joker, okay, even a comedian, he says, clap your hands for appreciation because it boosts his morale to tell more jokes. I'm a teacher. I'm not just making you time pass or entertainment or something. I am brainstorm. I am doing the operation, open brain surgery I am doing. So now, let us see here. I'm going to show you something important now. Personal pronouns. Now this is I is a singular number. Singular number. So number is based on one or more. We is plural number. Plural means more than one. I'm teaching you another thing. I taught you person now, and I'm teaching you number now. Number one is person. Number two is number. Okay. Now, here this is you are a boy is singular, and here he is a boy is singular, and she is a girl is singular. It is an animal is singular. Now let us see the next one, plural number. You all means more than one, or boys, plural number. And they are boys, plural number. Try to understand that. Okay. Right. So, now try to understand that one. All plural forms are. All plural forms, more than one, you use, okay? You use, yes, plural number. You use are. Yes. We are, you all are, they are. Fine. Now next one. So singular number you also is equal to plural because it's a mark of respect because the person is in front and you are as a respect you are saying. Even in your mother tongues also, there's a mark of respect. So that is what it is, respect. When somebody is in front of you, you have to give respect. So it is considered as, okay, singular number also. Second person singular number is considered as plural. Respect as a mark of respect because of that. Right. And a singular number, first person singular number, am is used. And all the third person singular number, it is one and the same, is. He is, she is, it is. That's all. Third person singular number, he, she, it. So we have learned about person. Okay, we have learned about person. First person. First person. I, we means the speakers. You all means the listeners. The listeners. The listeners. Bear with me. No problem. You will not have to suffer in the future. Okay. And third person, neither the listener nor the speaker is the third person. Only the speaker and the listener are there face to face, but this third person is not there. Okay. Absent person. Present persons are first person and second person. Absent persons are the third person. That's it. So I hope you understand what are personal. Okay. First person, second. Number. Number means one singular, more than one plural. That's all. Next, third one is gender. Gender. He is masculine gender. She is feminine gender, related to females. The next one is common or neuter gender. Common or neuter gender. Now, try to understand. And this plural, maybe masculine, feminine, common, neuter, or mixed. Anything. Only if it is a singular there. Masculine. Singular masculine gender, we consider it as is, he. And this is she. Common gender. Now you should know what is masculine gender, what is common gender, and what is neuter gender. Masculine gender means male, feminine gender means female, common gender means both. Both. Common means both. It may be a male animal or a female animal. Baby, teacher. Teacher is common gender. Sir is masculine gender. Ma'am is feminine gender. Sir, ma'am. So now try to understand. Teacher is common. Teacher may be for male and female. Once upon a time, I went to one school and I told him, teacher, listen to me. I'm not teacher, I'm sir. Useless fellow, how did you become a teacher in the first place? I thought that time. You understand what? People don't know, they don't realize. Teacher, why you are calling me teacher? I'm sir. That means sir is not the teacher. Okay. Master, you should call me master. What master? Master and miss. Master, mistress. That is totally different one. Master and mistress. Masculine and feminine. They are different. Sir and madam. They are different. Teacher can be master or mistress or sir or madam. It's common. And now neuter gender. What do you mean by neuter gender? Neuter gender means neither male nor female. Common gender means either male or female. Masculine means only male. Feminine means only female. Common means either male or female. It may be this or that. Neuter gender means neither this nor that. That means not this, not that. You should know what is either or, neither nor. I'm teaching you different things, okay? So here, I have shown you. How do you know that this is plural number? Because it is boys. So based on this boys, we have to use are. Wherever boys are there, are. Boys are. I hope you understand what makes the difference. A boy means singular, boys means plural. So how do you know that it is singular or plural? By the number. Boy is singular, boys is plural. Yes. Now, this is how you understand. Now I am showing you the next one. The next one is, so these are called personal pronouns. Personal pronouns, cases. Cases are everywhere. Personal pronouns, cases. Now let us see number one. Yes. Just listen to me very carefully, okay? I, capital letter. Me, my, mine, myself. I, me, my, mine, myself. Okay, that's it. Now let us see the next one. So what we'll do is place here. No. This is first person singular number. First person singular. That's it. 1s means first person singular. Then next is first person plural. We. Okay. We always comes in the, okay, small letter we'll write. We, us, are, ours, ourselves. Many people say, myself Harpreet Kaur, myself Abraham Lincoln. Never use that one because that is possessive case. Possessive case. This is person and number. This is nominative case. And this is accusative case. And this is first possessive. First possessive. And this is second possessive. Second possessive. Okay, first possessive. This is second possessive. Then this is reflexive. These are called cases. Nominative case, accusative case, first possessive case, second possessive case, and a reflexive case. So that's it. Next, second person singular. Okay, you, your, yours, yourselves. Plural will be s. Sorry. This is singular. Yourself. Then second person plural. I missed it. One more is there. So singular that is. Now this is plural. Here yourselves. Okay. Same things will come here also. But here it will be yourselves. Next. Third person singular, masculine gender. Masculine gender, that is he, his, he, him. After a long time I'm teaching these things. His. So this is apostrophe, his. Himself. Then third person, singular, feminine. She, her, hers, herself. Then third person, singular, common or neuter. It, its, itself. Then third person, plural, it will be same for everyone. They. Them. Their, theirs, themselves. So these are the rules. Okay, these are the rules which you have to follow. So I thought you understood what is first person, second person, singular number, plural number. These are personal pronouns, personalization. Avoid personalization as far as possible. It shows that you are a very weak candidate. You are a very weak candidate. Yes, now let us see here. Now let us see here. Do you, okay, Okay. Or the concepts. Don't write anything until I ask you. Are the concepts clear? Number one, what is number one? Person. Number two, number. Number three, gender. So are the three concepts clear? Say yes if it is yes, if you are clear. No if you say no. No if you say no. Whatever it is. Yes. So at least one more. So 14 students are there, 13 are there. So 7 I need. 1, 2, 3, 4 only. Okay. Yes. Fine. Right. Ooh. Yes. 1, 2, 3, 4. Yeah. So that's it. The word, it is not clear. So what, which word? Okay, you want me to have big size, huh? Okay, I'll do one thing. Yes. Size, yes. Size. Okay, is that clear now? Evelyn Brown. Is that clear now, Evelyn? Okay. Fine. This is how it is. So now these are the personal pronouns. Okay. These are personal pronouns. Print screen. Yes, I think Evelyn said yes, sir. Okay. That's it. Okay. Fine. So if you miss any notes, you can take it from the Telegram channel afterwards. And here it is. These are personal pronouns cases. Personal pronouns cases. This is just because of years of experience. Okay. Teaching English. Right. So next. Now, second one, this is B forms. We have seen only B forms now. Now we are going to see have forms. Okay. Have forms. Number 2. Have forms. So shall we move to the next level? Next level. Say yes or no. If you still have any confusion, you say, sir, explain something else or something like that. Or just say yes. So we are moving to the next level. 2 more yeses. Anyone has doubts? Even if 10 people say yes and 1 person says no, I will wait and I'll explain that. No problem. Please don't hesitate to ask me because I'm your teacher. Have forms. So now B forms are used as the first alternative for verbs. If verbs are already there, if there is no main verb, we use B forms. I am here. I am here. Okay. If there are no main verbs, B verbs are used. Okay. But main verb is already there. B forms are used to show present or past. If main verb is already there and have or has is there, then B is used to show the perfect tense. Okay. If be form is not there, have form will be there. I have it. I have. Finished. That is possession. So that's it. Right. Now, be have forms. Okay, now let us see here. Now, has, had, having. Right. Fine. Okay. It's clear. Yes, there you are. Now here, you can see it very clearly. Has and had. Sorry, one more thing is this. Sorry, not had. See what a mistake I have done. Have. Okay. That's it. Yeah. Has, had, having. Have, had, having. The first one is present tense, like previous one. First one is present tense, second one is past tense, third one is perfect tense, fourth one is perfect continuous tense. Or you can say present, past participle, present participle. Here also the same thing, have. So first one is present tense. Second one is past tense. Third one is past participle. Fourth one is present participle. How do you know this one? How do you know that this is past? It depends on the tense. I had cooked the food. I had cooked the food. I had my breakfast. The first had is past tense. The second had is past participle. I have had. The first one is present tense. The second one is perfect tense. I have had my breakfast. That means I have taken my breakfast. I have finished my breakfast. I have completed my breakfast. That is how it is. So first one is present. Has had. He has had. I have had. You have had. They have had. So plural, we use have. Second person also we use have. So no need to explain further because I have already explained be forms. Okay, I have, we have, you all have, he has had. So he, she, and it is special. I'm teaching you one rule for he, she, and it. Wherever he, she, and it are there, the next word will end in S. He is, she is, it is. He has, she has, it has. That's all. Or they play, he plays, she plays, it plays. That means the verb will take S in the ending. That is the rule. The rule is the immediate verb after he, she, and it will end in an S. If there is no S, you will add an S. For example, I am. But he is, she is, it is. You end in S. Next. I have. He has. S. She has. It has. So the next word for all the words, he, she, and it, the next word will end in S. That is rule by default. Is a rule by default. Whatever verb is, it will end in S. There is no excuse. The next one. I make, M-A-K-E, make. I teach. He makes, she makes, it makes. I teach, he teaches. S is there. He teaches. She teaches. It teaches. So now try to understand what I'm telling you. So he, she, and it are very peculiar. Okay. I do. He does. She does. It does. If it is a question, the previous word will end in S. Is he a boy? He is a boy. Is he a boy? He has he? She has she? It has it? Or do? I do. He does, she does, it does. Does he, does she, does it? So in the question form, the previous word will end in S. In normal sentence, the next word will end in S. Okay. Print a screen. So rule number, okay, we got a rule now here. Let us, okay, standardize this rule. Rule for third person singular number. Rule for standard rule for third person okay, third person singular number. Rule for standard rule for third person singular number. Yes. Standard rule for third person singular number. What is that standard rule? He, she, and it. Okay. So, he, she, it. These are the words. He, she, and it. Right. For these words, questions. Okay. Only questions. Only questions and question tags. Questions and question tags. Okay. Questions and question tags. Has he? Hasn't he? Like that. Questions and question tags. Now what you are going to do is the word before ends in S. For all other sentence types. Okay. The word after ends in S. I play. Okay. he plays, she plays, it plays. Do I play? No. Does he play? Does she play? Does it play? That's it. So I hope you understand the rule for this. Okay. Yeah. So he, she, and it. Questions and question tags. The word before ends in S. Has he completed? Many people I see in the groups, very many groups. There are many teachers. Okay. Right. I don't know what they're teaching. You just check them out. You check. Okay. Those who are teaching properly, that's very good. I really appreciate. Hats off to them. There are many people who don't write proper sentences. Okay. Anyone have books? Anyone have books? Okay. Anyone have books? Anyone, one means a singular. Anyone have books? Two mistakes in that sentence. You should use it. Does anyone have books? Okay. Does anyone have books? That's it. Okay. So be careful when you're using these sentences. Next. So the rules are clear. This is the rule. Right. Don't break the rule and you lose marks. You lose the marks. Never break the rule. So, he has played. I have played. Yes. Fine. So that is it. Now, is that clear? Those who have asked me, sir, what is the difference between was and were? Sir, how has and have and had? Is that clear now? Present tense is has. Present perfect is has had. What do you mean by present tense and present perfect tense? Now I'm going to show you the difference. Somebody asked me, okay, does anyone has correct or wrong? Does anyone have correct answers? Does anyone have correct answers? Does anyone have correct answers? That's what you have to tell. Does anyone have books? The singular comes forward. The other way have will be there. Okay. He takes book. He prepares food. He prepares food. Does he prepare food? No, prepares again. Again, you have to not see. Does is already singular. Why again singular? Does is singular. Then again you don't use singular. That's the problem. Only one singular in one sentence. You have to remember that. Okay. Yes. Now this girl has written one sentence. Does anyone has a pencil? See, even computer is telling it is wrong. Does anyone has a pencil? So see, this is a mistake. Because does is already made singular. Yes is already there. Then why again yes here? So here remove yes and put V. So I hope you understand. Only one singular will be there. Does. If does is there, then here has will not be there. It will be have only. Hope you understood. Hope you understood. Does anyone has is wrong. This is wrong. This is wrong. Does anyone have a pencil? This is correct. This is correct. So hope you understand what I'm showing you. Does anyone has a pencil? Does is singular, has is also singular. Why are you using double singulars in one sentence? Is that not nonsense? What is this does doing then? So does anyone have a pencil? So only one singular. So try to understand. He, anyone means he or she or it. So before, in the question it comes before. In the answer it comes after. I told you already now. I told you already now. Is the concept clear? Say yes if it is understood. If it is not understood, say no. Because this is a question, S comes before, not after. So there is no question of S here. After. Anyone means he. Anyone, this is a question. So why are you putting S after anyone? It's wrong. Before anyone you have to put in a question before anyone. Does he have a pencil? Okay, like, okay, 5 answers given. Very good. That's enough. So the concept is clear now. Right. So next. So now you understood how to find. So are you happy with the explanation? Shall we move on to the with the explanation? Are you happy with the explanation? Yes. So, right. So we made this grammar session because of the questions you asked. Fine. Now we shall move to the yes, case notes. Here is the case notes. Right. Here is the case notes, official case notes. This is official case notes. Nursing sample 3, Peter Dunbar. Okay. Now let us see here. What is important and what is not important, we have to see here. Right. Now I'm going to leave this one here. Whichever you want me to, for example, date, today's date. Whichever you want me to shade or underline or color. Okay, you type here in the chat box. So 22 January 2000, whatever you want me to underline, type. Forget about others. You do on your own. Whichever you want me to underline, I will underline. I will not underline anything. Whichever you think that it is relevant, I will underline. Others, I will not underline. Come on. Okay. So, come on. 1 second, please. Okay. Right. Right. The main course. Yeah. Many of the people, they think that they know everything. They don't want to attend. Oh, we know all these things. We don't want all these things. So we have to, we cannot leave them. No? So, oh. Even before it went, I deleted about. Okay. No problem. I can put it here. Right. Okay. So, come on. I'm going to show you all the words, whichever you type here. Okay. Okay. So name of the patient. Write down, no full. Whatever you, no, don't write like this. Mr. Peter Dunbar. Don't write name. Write Mr. Peter Dunbar. I'm not going to do name means which name? Patient is a name, nurse is a name, community is a name, center is a name, health is a name. Which name? Okay, like that. Community health center. Very good. Like that. Community health center, Divya D'Souza, you have to write in capital letters. Okay, now type again in capital letters. Otherwise, you'll write like this in the exam. Then it will be problem. Okay. Come on, come on. Come on, type all of you. What should I select? What notes should I select? We are doing live class now. If you type here in the chat box. So Divya typed, okay, Deepthi typed Mr. Peter Dunbar. Very good. DOB, capital letters you have to write, not small letters. So Community Health Center, yeah. Divya D'Souza written, capital letters. So I have corrected here. Then next is Peter Dunbar, Mr. Peter Dunbar. Okay. Next. Whatever you type here, whichever is important, I will highlight. Those will go into the letter. Come on, come on. Anything else is there which is important here? A patient you are monitoring will move into another. A patient you have been monitoring is moving to another city to live with his daughter. Okay. Current medication. Okay. Current medication will go into, okay. Currently, the medications are, okay. Yes, it will go. The current, his current medications are. Okay. Yeah. Yes, date of birth, 18 March. Yeah. This will go. Very good. Right. Current medication done. Nurse, very good. This also will go. Right. Very good. You are a nurse in the community patient you have been monitoring is moving to another city to live with his daughter. So today also will go into the letter. Today. Being discharged today or something. Okay, today is being discharged today, like that. So diagnosed with type 2 diabetes. Okay. Diagnosed with type 2 diabetes. That is long back. Okay, fine. Still we'll take it. That is in August 2016. So that also will go. Okay, anything else? Check. Type. Whatever you are typing, I will take you there. Yes, diagnosed with type 2 diabetes. What else? Dietary needs. So recommended dietary management. Okay. Recommended dietary management. Okay. Right. Whatever you tell, that only I'll underline. Dietary needs. Okay. NV Jacob. Elizabeth recommended dietary management. Patient continues to require monitoring. Patient requires continuation of monitoring and encouragement. continuation of monitoring, regular monitoring or ongoing monitoring. Okay. Non-compliance with medication. Okay. Non-compliant with medication. Where is it? Okay. Okay. Non-compliant with medication. Non-compliant with medication. Here it is. Very good. Okay, that is underlined. Then non-compliance with medication. Non-compliance with medication. Patients like 2-3 glasses of wine. Okay. Right. Consider it carefully. Yeah, come on, write down all of you. Once you write, I'll take everything. Okay. Okay. Non-compliance with the diet, very good. The patient is not needed. Non-compliant with the diet, that's enough. Okay. What else? No problem, study. We'll take the time to study because we have to improve. So non-compliance with diet. Fine, come on. Identify more information. Yes. Next, type. Whatever you feel. Okay, I'm pulling it a little down, no problem. I'll give you a second round, no worries. Whatever you feel important, you write according to your knowledge. Takes medication intermittently. Very good. 1. Myocardial infarction and its management. Okay, myocardial infarction. Okay. Hospitalized. Okay, hospitalized. Okay. Fine. Okay. Management means treatment. Okay. Yeah, whatever words you are giving, I am taking. Carry on. Hospitalized with myocardial treatment. Okay, done treatment. Signs of diabetic neuropathy. Very good. That is signs of diabetic neuropathy. Oh, you went into the next paragraph. Okay, you have the case notes with you. Okay. Signs of diabetic neuropathy is here. Okay. Okay, commenced what? Okay, commenced. Okay, commenced what? Okay, commenced. Fine, we can take commenced. Education given regarding importance of medication. Education given. regarding importance of medication. Okay, right. Education, yeah, requires education. Requires education, okay. Okay. Oh, last seats are left. Those are also getting filled up. Recommended by our old students who passed. Good. Yeah, you can call me. I want to close my admissions first. Okay. Right. Yeah, I told you 3 admissions are there. So 3 admissions I am taking. That's all. Remaining 3 admissions are there. In March 2018. Okay. In March 2018. Where is in March 2018? Okay, March 2018. Okay, fine. March 2018. Okay. Why in March 2018? Is it necessary? In March 2018, what? Can I continue? Okay. Fine. Hello. So, require monitoring and encouragement. Require monitoring and encouragement. Require monitoring. Patient continues to require. Okay. Patient continues to require monitoring. And so continues to is not in it. Monitor is required. Okay, fine. Right. Respiratory infection 2 weeks ago. Okay, where is the 2 weeks ago? Yeah. Respiratory infection 2 weeks ago. Okay, fine. Then what are the other require monitoring and engagement? Had respiratory infection 2 weeks ago. Wife deceased. Wife deceased. Wife passed away. Okay, fine. Anything else? Come on, come on, come on. I'm going to show you more. It is important, only you tell me. Yeah. Okay, next. Okay, next page. Okay. Yeah, next part. Next part. Okay. Come on, find out the words and write down. Yes. Had respiratory infection 2 weeks ago. What about the others? Any other points? Uh, so what about this one? Diagnosed with atrial fibrillation. He went for the treatment of myocardial infarction and he was diagnosed with atrial fibrillation. Is that not important? Okay, right. What is it? What about this medication? Sotalol and warfarin. Don't you think this is needed? Okay. Sotalol and warfarin. Okay. So this is on the same day. He was hospitalized on the same day, on the same time, same admission. Okay. So he was admitted to which hospital? City Hospital, Newtown. Newtown City Hospital. Okay. And what else? Um, and what else you have to see? Come on, write down some more points. Yes. Patient attended with daughter moving to Centerville to live with daughter and her husband. So that is important. That is, he's moving places. He's moving places. Yeah. Then next. So myocardial infarction. So he was admitted in City Hospital, Newtown. Okay. Then here. Then now patient attended with dot. Okay. Patient needs and monitoring. Education should be provided regarding needs and monitoring of the patient. Okay. Regarding diet and other things. Next. Now here intermittent medications. Okay. Intermittent medication compliance. Okay, fine. Then what else? Again provided education regarding medication regimen. Education regarding the importance of, yes, this is also important. Okay, fine. Right. Come on, other points, please. Just 3 more minutes I'll give and I'll start explaining. Yes. So nobody. Okay, we'll move forward now. Now let us see here what is important and what is not important. Fine. So today's date is 22nd January 2019, Nurse Community Health Center. And Mr. Peter Dunbar is moving to another city. We have already seen there. And then 18th March 1932, current medication. What are his current medications? Current medications are very important because it is, yeah, metformin and ramipril and warfarin and sotalol. These will go into these things. Okay, fine. Now here, right, ramipril for hypertension. That's important, right? So sotalol and warfarin are given. Metformin, okay. Next, doctor recommended dietary management, which includes low fat, low sugar, and low calorie, okay, diet, along with limited alcohol and increased exercises. These are important. These are important. Exercise should be increased. Alcohol should be decreased. Low fat, low sugar, and low calorie. Okay. Low fat, low sugar, calorie restricted diet. In addition to limiting alcohol, minimizing alcohol, or reducing alcohol, and increasing exercise. These are recommended. Okay. Right. Now, so this is very old. So fine, that is compulsory. So it has gone up. The next one, wife deceased. Okay. So again, non-compliant with diet. Fasting blood sugar levels 9, non-compliant with diet. Okay, now, so again he was referred to the doctor. Referred to the doctor. Fine. Now let us see here. So non-compliant with diet and non-compliant with medication. We can see there. And he's blaming his poor memory for this. He's blaming poor memory for this. Okay. Poor memory for this. Right. The next one. Right. Having done this one. So he is still eating excessive fat. He is still consuming excessive fat and excessive salt and excessive sugar and excessive alcohol. Okay. He consumes wine and beer. That's it. These are important here. Okay. He's not following anything. That's why he was sent back. Noticed all these things. Now, doctor prescribed metformin, which is an oral hypoglycemic agent, has been prescribed. Okay, fine. Next. Now let us see here. What else? Now the present condition. Okay, he is walking with a stick. Okay, walking with a stick, right? So non-compliant with diet continues. Still the same thing. Right. Then what else? So walking with a stick. The next one. You can see here. Again provided education regarding importance to adherence of drug regimen, medication. Is not giving importance even now. Okay. So discontinued all medications. That's why. Right. Education regarding drugs, medication, importance of medication regimen. In spite of that, he is not following it. Intermittent medication. Intermittently, he is taking these things. Okay. So what should go into the first? First, I'm selecting the material. Then afterwards, we'll see organization of the letter. Organization of the letter. Right. And this is a transfer letter. Don't write, I am writing to refer. Don't, many people write for everything, writing to refer. I don't know how they are saying everywhere, writing to refer, writing to refer, writing to refer. I've seen in one very famous, okay, channel. Everywhere writing to refer. He is being transferred to here. I am writing to refer, he is being transferred. Whether it is transfer letter or referral letter, we don't know. Right. Refuses to reduce salt, sugar, alcohol, and fatty acids. Say this is it. Is not ready to change. Resistant to dietary alterations. Resistant and medication also. Most serious case. Sometimes in double doses also. Sometimes misses and double doses medication. Okay. So, we are writing to the community health nurse. That is what it is. So this is the community health nurse. Okay. You're writing to the community health nurse. Okay. So better than this, you can write here. This is the community health nurse. Then Eastern Community Health Center, second line. 456 East Street, third line. Centerville, fourth line. Okay. So important information is coming from here also. Writing task. Using the information, write a letter to the community health center, community health nursing center, outlining the patient history. So you have to outline the patient's history. That means give the history of the patient. And second thing is you have to request ongoing monitoring. So ongoing monitoring you have to request. So these are the points. These are the points you have to notice. Okay. This is the information. Now, which is more important here? There are 2 or 3 problems. Which is more important problem? So diagnosed with diabetes is one problem. And then he was admitted with myocardial infarction, and during that time, okay, atrial fibrillation was diagnosed. He was admitted with myocardial infarction, and that time atrial fibrillation. So this is point number 3. Okay. And now signs of diabetic neuropathy here. So which is the latest one and which is the most important one? So 3 things are there. 3 points are there. Number 1 is this one. The very old problem, type 2 diabetes mellitus. Okay. This is the problem number 1. This is problem number 1. This is problem number 1. That is type 2 diabetes. Myocardial infarction diagnosed with. So 3 things are diagnosed here. First one is type 2 diabetes mellitus was diagnosed and diagnosed with atrial fibrillation. That is the second one. Atrial fibrillation. And third one is signs of diabetic neuropathy. So now in these 3 things, which is more important? Come on, type your answer, 1 or 2 or 3. Which is more important? Okay, 1 minute. Which is more serious problem? Which is more serious problem? Number 1. Number 1 is type 2 diabetes. Number 2 is atrial fibrillation. Number 3 is diabetic neuropathy. So now which of these 3 things, 1 or 2 or 3, which is more serious problem? Come on, fast. 10 seconds for this. Ten seconds for this. 10 seconds for this. Yes, come on, fast. Which is more important? Okay. So 2 and 3 is a clash. Okay. Okay, 2 are there, 3 are there. Okay. So 3 is powerful. Okay. Let us take 3. Yes, 3 is more important because diabetes is common, but diabetic neuropathy is even stronger. Stronger problem. Stronger problem it is. Diabetic neuropathy is stronger problem. Mosquitoes వస్తున్నాయి ఇది చూ. Fan close, switch off the fan. Switch off the fan, please. Okay. Okay. So diabetic neuropathy is the more serious problem. And the secondary, okay, the basic problem is diabetes. First write diabetic neuropathy, then you write diabetes. These are two are related, so you write them in first paragraph. Or you change it into diabetic neuropathy into first paragraph, diabetes mellitus in second paragraph, and atrial fibrillation in third paragraph. So that is organization. That is organization. More serious problem is diabetic neuropathy. Diabetic neuropathy is the more serious problem. Okay. There you go. So this one, okay, this one and this one. Okay. So first priority, topmost priority is this. And some people have written atrial fibrillation. Okay, atrial fibrillation, you see, let us see here. Diagnosed with atrial fibrillation post myocardial infarction, commenced sotalol and warfarin, that is enough, finished. So now what is this atrial fibrillation and what is this myocardial infarction? Myocardial infarction was there. Okay, he had myocardial infarction, so he was admitted to the hospital, and that time they diagnosed atrial fibrillation and he was discharged. And after that he attended twice daily. So that means where is the problem now? No problem. No? So why are you thinking of atrial fibrillation? So the more important problem is the signs of diabetic neuropathy. This is point number 1. So paragraph number 1, more serious problem. I told you how many times should I tell you the more serious problem will be first paragraph. More serious problem. If it is urgent, urgent problem is serious automatically. If it is not urgent, in the ordinary, more serious problem is diabetic neuropathy. Is a serious kind of diabetes. Okay. Then next you have to write diabetes which is more serious. So next serious. So you write in the second paragraph or write in the first paragraph itself after diabetic neuropathy, because they both belong to the same family. Then third one is here, myocardial infarction and atrial fibrillation. So these you write in the third paragraph. Okay. So 3 paragraphs you will write in the middle. First one is diabetic neuropathy. Second one is diabetes. Okay. And third one is myocardial infarction. So that's it. So these are the things which you have to notice. And there itself with the diabetes, everything you have to explain. Right. Fine. So now let us see here. Every day, I will explain 1 or 2 letters, or maybe 3 letters. Daily, 3 letters, or you can say daily 1 letter. Daily 1 letter, I will explain. Actually, I will explain. Okay. Daily 1 letter, I will explain. Okay. Will that be good? Or you will write a letter and I will correct. Which is better you feel? I will explain and then you write, or you write and I will correct. Which is better, you think? A is better or B is better? First option or second option? First or second, write anyone. One or two. Your suggestion. Your suggestion. Yes. Regular students know that. Regular students who have registered the course know that very clearly. I know. I need not tell you. And the result will be there. So you do all the mistakes and I break my head. That is the second option. Okay. That is the second option. You write all the mistakes in the world and I correct almost 50 mistakes. So that is the second option. And the first option is learn efficiently and do not do mistakes at all. So that is the first option. I have given you options, but I know, okay, the regular students will definitely, because you have been doing many mistakes like that. So now I'm teaching this so that you will not do any mistakes. That will be better. Yeah, I'm very happy. The other day, Gail letter, many people have written very nice. Yeah, I'm very proud of you. So attend the sessions like that. So now, those who select number 1, okay. So number 1 will be given number 1. Fine. Those who want number 2 will be given number 2. Yes, that is your choice. You have asked me. You asking lectures, sir, teach us first, then we'll write. So minimum number of mistakes will be there because everything I will explain. Then on Saturday, you'll write the mock test and I will correct. There will be very less mistakes. Okay, no problem. That's very fine. So learn and write, or do and get corrected. So those are the two options. So whatever is your choice, you can do. And I am definitely correcting the letters, and I am definitely, anyhow, I'll correct the letters. But those who ask for the second option will only get the corrected letters. Okay, only will get the corrected letters. And those who asked for the lecture and then write, they will get the lecture, and afterwards they will get the corrections. So definitely, in the beginning itself, they will correct 75% of the mistakes. And after correction, you will correct the remaining 25 mistakes. I will explain that also will correct. So which is the best option, you choose. Because you are my children, I will want to give the best. So you want only 25%? Because if you do 50 mistakes, I cannot correct all the 50 mistakes. It's a waste of time for me. And still, okay, you will not learn the basics. And again, next letter, again, the same mistakes will be there. So that is the option. Number 1, I teach you everything because you don't know anything. Suppose 75% you will understand. So 75% will be correct. And only 25 mistakes will be there. So that is better. No? So those 25 mistakes also you can correct when you get the paper correction. Before writing only, you will get 75% correct. And after writing, you will get the remaining 25% correct. That's it. So these are the two choices. Whichever you feel comfortable, you can do. That is open to you, right? And from Monday onwards, there are serious sessions. I'm giving the timetable. Huh? I'm giving the timetable. Right. Follow the timetable. And if you are not able, I will put it in the classical corrections. Okay. I'll put it in the classical corrections group. Okay. There only. All these lectures will not be in the YouTube. From Monday onwards, whatever lectures I teach, they will not be on the YouTube. And everyone cannot join also. Because I'm not giving everyone. Okay. So now, because many people, okay, they are asking me, so I'm giving some free sessions. Okay. So my children's time I'm giving to others also. So from Monday onwards, that is not possible. Only on Saturday, when there's a mock test, I'll give open classes. Otherwise, everything will be fine. And open classes also I'll not put on the YouTube. Because there are some students, no, they don't want to attend the classes. They just want to learn from the YouTube. I don't know what they will learn there. Huh? That's good. Right. My children means my children. That's all. There is no question. So this will go into the third paragraph. Now, first paragraph, what sentences will go? Second paragraph. We are going to write all the things. Okay. We are going to write all the things. Fine. Now, so this is called selection of or selecting relevant information. This is stage 1. First one is picking up information, selecting relevant information. And second stage is writing a letter. So we'll go to the second stage. That is part 2. Part 2. Now let us see this. The same link you will come again, okay? The same link you will come again afterwards. So, are you happy with this session? Stage 1. Stage 1, are you happy or do you have any doubts or anything? Because next session, I'm going to have my dinner because I did not have lunch because I was planning for the next session. So I did not have. So now I'm going to dinner. So come on, shoot your answer first. Right. The next question is, who wants to join the second stage? Say yes. If you want to join the second stage, say yes, so that I'll send you the link. I'll send you the link. Fine. Second stage, we are going to write every word line by line from the top to the bottom, head to toe. Everything I'll write. Everything I'll write. So the letter, in the Telegram group, okay, this is the link in the Telegram group. Okay, this is the Telegram group. Okay, in the Telegram, you go to the last stage. There you have the PDF. Here is the PDF. Okay. Here, Peter Dunbar. Where is the PDF? PDF. Did I post the PDF here? I did not send the PDFs. Okay, no problem. You can just type a Peter Dunbar. Peter Dunbar. Case notes. And you will get case notes Peter Dunbar. See here. This is case notes Peter Dunbar. Okay, and this is letter Peter Dunbar. These two. Okay, nursing sample. Is this Peter Dunbar? Yeah, Peter Dunbar, yes. So this is Peter Dunbar. Yeah, Peter Dunbar, fine. So this is Peter Dunbar, yeah. You can go through this forward to classical corrections to the bottom, fresh. It is there fresh. This is the letter, sample letter, and this is the second page. This is the first page, and this is the PDF. PDF is here. And if you don't have channel, directly join the channel only. Don't join the group, because channel people will get lot of benefits. Okay, this is the channel. This is the group. Group link also I'm giving, but try to join in the first one. Okay, this is the group. First one is channel CC, OET CC, OET classical corrections. Second one is OET classical corrections conference, the meeting, the group. Group will not be much beneficial. Join the first one, that will be beneficial. Okay. So we'll meet. Now it is 22:41. We'll meet exactly after 20 minutes. Is that enough, 20 minutes? Or you want half an hour? 20 minutes or 30 minutes or 60 minutes? If you want to have dinner or lunch or breakfast or anything, 20 minutes or 30 minutes or 60 minutes, just write the number. Write the number. Write the number first. So 2:30s. Come on, fast. Okay, 3:30s. What about the others? Let us decide first. Yeah, 4:30s. Yeah, I can also have dinner leisurely. So 4:30s are there. 3 more 30s are needed because half score. Okay, 1, 2, 3, 4, 5, 6. One more. One more. Yes, majority vote. So 1, 2, 3, 4, 5, 6 people only gave. One more. So total 12 are there. Okay, out of 11, no? Yeah. Fine, that's it. So 30 minutes, we are back. After 30 minutes. Okay, bye-bye.